A year into the pandemic, behavior changes, including staying home and picking up unhealthy habits, have added up.
A new report finds the prolonged pandemic-related stress is seriously affecting mental and physical health.
Dr. Shyla Murgain of UW Health joins us to talk more about this. Shyla, good to see you again.
Hi, Shyla.
Hi, thanks for having me.
Let's talk about the American Psychological Association's Stress in America survey that just came out. What did it show?
This is really striking. They measured people over the past year and found four key things really indicating people aren't coping very well with stress. They found the majority of Americans are having stress, and number one, 61% reported having undesired weight gain. On average, it was a weight gain of 29 pounds. 67% said that they were sleeping more or less than they wanted to. 47% said they delayed or canceled healthcare services, and 23% reported that they were drinking more alcohol to cope with their stress. And this is really significant because if we're not coping with stress effectively and we're choosing some of these maladaptive ways, this can really lead to long-term mental health and physical health consequences.
Talk a little bit about the most vulnerable groups that the survey identified.
Yeah, they found four vulnerable groups. One, parents with young children under the age of 18, essential workers, including those healthcare workers on the front lines, people of color, and also younger adults who are really vulnerable to having a lot of stress and not coping well.
So how do you cope?
So it's such a great question, Mark. We want to think about stress is going to happen. We're designed to deal with stress, but we want to work on recovery. I think about it as a teeter-totter. Stress happens. We want to notice we're stressed and then engage in active recovery. Lots of things we can do to, in a sense, let off that stress steam. We can exercise, spend time with friends, get out in nature, play with a pet, do a hobby. Well, one of the practices I always encourage people to work on that recovery after your stress is simply to engage the relaxation response by doing some simple breathing practices.
You always have an example for us. You're going to walk us through one of your breathing techniques?
I am. When we're stressed, we tend to breathe really shallow in our chest. And this is often referred to as stress as survival breathing. So the first practice to engage that relaxation response is to breathe slower and lower in the body. So you're doing belly breathing. Breathing in, stomach is expanding with air like a balloon filling with air. And breathing out, stomach is going in towards the spine. So think about a balloon inflating as you breathe in, balloon deflating. And in particular, the breath practice is a 4-6 breath practice, breathing in for 4 and then breathing out for 6. You're lengthening the out breath, which helps to activate that relaxation response. Really good for our physiology. It's good for our mental health as well, and it's going to help our system get back into balance.
And you have a technique for energy as well.
There is. You can so the 4-6 breath practice you can do actually for a couple minutes, even up to 20 minutes a day is optimal, but even a few minutes helps. A 4-7 breath practice is simply breathe in for 4, hold for 7, breathe out for 8. And you only need to do that for a couple breaths. That can really energize us if we're feeling sluggish or kind of feeling some brain fog and we just need a little pep in our step. So breathe in for 4, hold for 7, breathe out for 8.
What is square breathing for COVID long haulers? What does that involve?
Yeah, this was a breathing technique that has been prescribed for people who may have COVID that are still having a lot of symptoms. And square breathing is quite simply breathe in, maybe for the count of 4, hold for 4, breathe out for the count of 4, and hold for 4. What it does is it helps people focus on the breath and just helps them get into a nice rhythm. You can also, anyone can do it, but in particular, if people have had COVID and still struggling with some of those various symptoms that might be equated to those long haul symptoms. Breathing in for 4, hold for 4, breathe out for 4, hold for 4.
Great information as always. Shyla, thanks for being with us today.
Feel calmer already. Thank you, Shyla.
Thank you. Great
Good to
be
see
here.
you.